Hello, happy Tuesday. Welcome, everyone. I'm so excited you decided to join us tonight. Let me get our speaker view here. Fantastic. My name is Dr. Staci. I have a PhD in integrative medicine and functional medicine. If you're wondering if you're a guest tonight and you're new, that means I do not write prescriptions. I'm into all types of things, holistic and alternative, integrative, and looking for solutions and root causes and helping people have the best quality of life. So the information that I'm going to share with you guys tonight is not here, of course, to be a cure or treatment. I'm not here to diagnose you with anything. If you have any specific types of diseases or disorders or syndromes, we're not going to be discussing those this evening. You can tell me all about your symptoms. I love to call it my grocery list of problems. So if you have a grocery list, if you don't have a grocery list, that's what we use our health tracker for. Grab your health tracker, ask the person that invited you. They can help you fill out your health tracker. And so you can make your own grocery list of things that you would like to be able to check off, so that helps you improve your quality of life. Or maybe you're like me and you don't have anything on your grocery list. I had nothing on my grocery list a year and a half ago when I stumbled upon this technology in my never-ending quest for always looking for the latest and greatest and the best things in alternative, holistic, and quantum modalities to help the body achieve a better quality of life, and of course for vitality and longevity. So for me, I had nothing on that list. So I was looking for preventing those big major killers, right? Heart disease, cancer, diabetes, Alzheimer's, dementia, all those degenerative age-related diseases. I wanted to prevent those. That's why I decided to start using this technology myself. And of course, for vitality and longevity, we know that stem cells, your body's stem cells, are the holy grail of healing. And we know that you have an abundance of stem cells when you're young. And we also know as we age, that supply declines. We can see by the time you're in your 30s, your body has about half of the stem cells present, active and working. And by the time you're in your 60s, anybody in here in their 60s, you have less than 10% of your stem cells actually active and moving and doing things in your body to keep you young and youthful. Hence the age-related diseases and the decline in the body, right? And so what I found a year and a half ago is what I'm going to share with you guys tonight. And that is the stem cell activation patch. This little patch comes in a sleeve like this in a month supply. This little patch is non-transdermal. And non-transdermal means that nothing is transferring into your body. And so you're really probably familiar with transdermal patches like nicotine patches, pain patches, birth control, hormone patches, that kind of stuff. Those transfer a chemical or a substance into the body. And so this works very differently in that nothing is transferring in. And so how is it working if there's nothing going into the body? Well, this is a wearable light technology. The term is actually called photobiomodulation or phototherapy. And so it uses our body's own light or heat that we emit. We are 98.6. If you can feel your chest right now, you can feel the heat coming off of your body, correct? Maybe your hands are chilly. Maybe that indicates you need a little bit of a liver detox. If your hands are chilly or your feet are chilly, but you can feel that your chest is warm, because the core of your body is always warm, right? And so we know that we emit this light or this heat because we can go outside right now here on the East Coast where Laura and I are. It's 8 o'clock and it's dark outside. So if we went outside to see our neighbors or the animals across the street or whatever, we can't see any type of human or animal unless we have night vision goggles. Night vision goggles allows us to see the outline of the person in colors, red, blue, green, yellow. That is the heat or light that our body is emitting. This patch works with that body heat or light, okay? And so how that works is, see this white part? Embedded in that white part is a crystal lattice structure. And so this structure looks like kind of like this. It's a crystal lattice, and it's made up of a compound, a solution of organic amino acids, salts, water, oxygen. And so those molecules form a crystal lattice structure. That structure is embedded in here. When we place this patch on our body's heat reflects back a very specific wavelength of light back into our body from the lattice structure that's in that patch. That wavelength of light is what signals your body your own body's GHKCU copper peptide, to activate that copper peptide, elevate it, to actually reset a third of your genes to their young, youthful, healthy state, and in turn, activating, mobilizing your own stem cells. So this is not putting stem cells in your body, okay? I've spent 20 years researching stem cells. I banked both my kids' cord blood. I did over 10 years of different types of stem cell therapy with my daughter in and out of the country, including stem cell injections. This is not a stem cell, not a donor cell, not your own stem cells going into your body. This is a patch that signals your body to mobilize your own stem cells, activate and elevate your own stem cells. They go to work to repair and regenerate, rejuvenate, restore whatever it is in your body. Remember that grocery list I mentioned? We're going to start checking things off that list from using this technology, because it goes to work immediately to start repairing your body. How do we know this? Clinical studies. We've had done over 90 clinical studies. David Schmidt is the inventor of this technology. He actually started inventing this type of technology, a different patch, 20 years ago when he was working for the Navy SEALs. And so over the last 20 years, he has invented a dozen different patches, but it took him 10 years in the lab to figure out how to signal the body to activate and elevate and mobilize its own stem cells. And that is what X39 does. It's a stem cell activation patch. It helps your body to do what it did when it was younger. Remember, when you're young, you have boundless amounts of energy, you sleep at the drop of a hat, you go, 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 go. Your mind is wide open and just ready to take everything in. And of course, your body is vibrant, full of life, right? 5-year-olds don't have gray hair, 10-year-olds don't have back pain, 12-year-olds don't have heart disease, because their body's always working to repair itself and keep it nice and young and youthful and healthy, lots of stem cells on board. And so this patch is going to give you back that, not to your 10 or 5 years old, but give you that back to your 25-year-old vitality, right? To your youth. And we see that this happens about every 6 months, is about 8 years younger. That's kind of the average. So about every 6 months using the patch, we see about an 8-year reduction when we look at the cellular level of the body. So how long do I have to wear this patch then to get my results? Well, obviously it depends on your age. We always have a starting point, and that starting point is 1 month for every 10 years you are old. So to get up to your full stem cell production. So if you're in your 30s, well, that's about 3 months, right? You've already got to have your stem cells. It's probably going to take about 90 days to get back up to that full stem cell production. And of course, if you're in your 60s, it's going to take 6 months. And, if you're in your 80s, 8 months, and obviously 90s, 9 months, things like that. And then we look at, what's on my list. Have I been dealing with chronic fatigue, fibromyalgia, lupus, MS, gut issues, sleep issues, memory, I'm just rattling off things that people tell me on a daily basis. There's a lot of stuff going on in there, right? So it's probably going to take a little bit longer to get your body back into balance. It's kind of like saying, well, I want to lose 50 pounds and I'd like to do that in 30 days, please. Like, well, you'll be dead. So we're not going to do that. So we're going to do this over time so that you do it correctly and successfully so that you feel better without any side effects or any repercussions, right? That's what we talk about, weight loss, right? People always talk about weight loss. It's almost January. So people are thinking, I've got to get this weight off after the holidays. And so we want to think about this using this technology, and not as a quick fix, not as I want to hurry up and get all my results in 30 days, but yet I'm going to know that this is going to take a little bit of time for my body to get back into balance, into homeostasis. How long? It's different for every single person. Every single person has a different body on the inside. So what's going to happen for you is going to be different than what's going to happen for me and for Laura and for Sharon and for Patricia and everybody else on here, right? We are all very different. But know that here's some common things that people experience first. They experience pain loss. They experience more mental clarity and energy, concentration, focus. They have a deeper sleep, quality sleep, REM sleep. Of course, faster wound healing. We see that all the time with people that, have had surgeries and accidents, things like that have happened with their skin and with their body. And we can see that the body heals very quickly with using this technology, and also faster recovery from their daily activity and fitness. And so those are some of the first common things we see, usually in the first 3 to 6 weeks. Sometimes people see those things a little sooner, but we always go by clinical studies, which are about 3 to 6 weeks. And then we start to see improvements in your digestive system, your nervous system, and your immune system. But what I think is probably one of the most remarkable things is really what happens around 6 weeks. And I always share this because the number one killer is heart disease. We know that. That's common. You can Google it. You can talk to any doctor and they're going to tell you the majority of people that die of heart disease, something to do heart related. And we can see from using this patch that not at week 1, 2, 3, 4, or 5 are there any improvements in the vascular system. But at week 6, we can see improvements in the vascular system in clinical studies. Your vascular system starts functioning as if it were 8 weeks younger. We can see the improvements in studies. And so that's what I love about this, that it does all the other stuff too, but you only have one heart, right? And we have to make sure we take care of that. And so being able to reverse the functionality of my heart is really important, keeping my heart young, youthful, healthy, vibrant, my entire vascular system. So there's a compound effect to using this patch. Remember I said it resets a third of your genes. Well, we know that each gene expresses to 1 or 2 other genes. It's just what's happening inside of your body. And so if you're using this day after day, week after week, month after month, then that compound effect is going to continue to exponentially reverse, repair, regenerate, and restore the body. And we see this for participants that are using this patch, and even all of you guys that have been using this, right? I've been using this a year and a half. We see this from you, been using it 6, 8, 10, 12, 14, 18 plus months. Marcy, Peter, they've been using it for 3 years. And we can see the benefits not only on the outside, which those show up pretty, evident as well too, but also on the inside, what's happening. I had somebody message me earlier and she's like, just a few months and my blood sugar's down and, my glucose, everything's changed. And, I can see improvements in my lab work in just a couple months. And I'm like, that's fantastic. Can you imagine what's going to happen in the next couple months or even in a year, what's going to happen with your body? And so that compound effect of using the patch day after day, week after week, month after month, even past your required or recommended age amount is really going to make big differences. And so know that when you use this patch, there are no side effects. There are no contraindications to what you're using or doing. There's nothing harmful. There's nothing toxic. There's nothing going into your body, right? It's non-invasive. So you can use this knowing that, oh my gosh, I'm on this medicine or I'm on this one, but I'd like to get off that one. And, I'm using these supplements or, I'm using these homeopathic remedies. Everything is perfectly fine to use with this patch because it is putting nothing into your body. So there's nothing to interact with. And then you have to be careful with medications and supplements and herbs. There are a lot of contraindications of those coming together. So you have to really be careful with that, which we always say, check with your doctor, check with your pharmacist, and of course, check with them on this as well too. I'd love for you to introduce this to them so they can help even more people, right, with their patients that they have. But knowing that there are no contraindications because there's nothing going in the body. So there's no interactions. Know that it's only going to help you, benefit you. And of course, if you're on medications, then your doctor is monitoring those. You may be able to help, help yourself come down on the medications or even come off of them. Never stop cold turkey, please. But even be able to come off medications. We see that happen with a lot of people where they're lowering doses and then they're able to come off anxiety, depression meds, and, hormone types of things. And you name it, we've seen all kinds of medications that people have been using. Blood pressure medications have had to been lowered. That happens a lot with people. So know that you can use this and feel safe about it, but that you can also feel safe about sharing this with other people because of the fact that it is literally working inside of your body at the speed of light with light. And so what I want to do now, because I want to kind of give a little shorter explanation, because I know a lot of you know how this technology works, or maybe you've seen a video or you've watched some things. I really want to make sure, because last time we didn't get all of the questions answered, kind of ran out of time. So I want to make sure that I have time for you to ask your questions. So if you have a question, and I just want to kind of preface this again, that make sure that you are not, talking about a specific disease. Like, don't say, well, what do you recommend for diabetes? Because I'm not able to talk about diseases or disorders or syndromes I can talk about your symptoms. So if you're saying, oh, well, what do you have for diabetes? Then ask me what would be beneficial if my blood sugar is high, elevated. What would be beneficial if my blood pressure is high? Those types of things. What about if I'm in pain? What about if I don't sleep? What if I have issues with my endocrine system? So those are the types of things that, and maybe you don't know those words necessarily. So don't feel like, oh my gosh, I can't say to her my disease. You can. I'll just reference it and preference that with, I'm going to talk to you about the systems in the body. Because like I said, David's invented a dozen patches over the last 20 years. He has clinical studies on every single patch. They've all been done with people. They've been done from independent labs and doctors and researchers around the globe, many double-blind placebo independent studies. And so, the information I'm going to share with you is going to be based on those studies. We have thousands of testimonials. We literally do every single night for the last 3 years, 5 nights a week. We have recorded 2 people's personal testimonials, and they're saying what's going on with them, what patch they used, and then how it helped improve their life. And so we have those in a database. So we have lots of testimonials where people say, I had XYZ disease or XYZ disorder, and I used this patch, and then here's the time frame, and here's what I got to experience. And we can obviously share those with you. Check with the person that invited you. They can pull up those off our Telegram channel. But I'm just going to speak in regards to the clinical studies, okay? Oh, okay. So a customer asked me why she's not feeling the effects of the patches like she did with the 5-day gift. So here's what you have to remember. Everybody's body is going to react and respond differently every single day, okay? Because things are happening, things are shifting, things are changing. And here's what happens initially with people. And sometimes it happens in the first 5 days, not very often. Sometimes it happens in the first 3 to 6 weeks. When you put the patch on, it elevates your GHKCU. And Laura's going to put a beautiful website in the chat for me. It's reverseagingwithghk.com. And that website is a Dr. Lauren Picard. He has spent over 5 decades researching and doing clinical studies with GHKCU, copper peptide. That's where David got his beginning thoughts and ideas with this patch, specifically the stem cell activation patch. And so when you elevate GHKCU, which obviously declines as we age, when you elevate GHKCU, initially people do experience those quick results, right? The pain reduction, the more energy, the more clarity, the physical energy, mental energy, better sleep. They see those things pretty quickly because of the elevation of GHKCU. And sometimes what happens is, as your body's stem cell production kicks in, then those stem cells start to go to work in areas that your body needs. So you may not feel that burst of energy that you did in the very beginning because your body is really focusing on, oh, okay, great, we're going to use this stuff to get your body well again. And so we're going to go into those areas. And so you may not feel that big jolt as you did in the beginning. I'll be honest with you, I never felt a big burst of energy or a big woo, when I first started the patches. I didn't feel a darn thing for 3 weeks. And even at that, I didn't even realize what I was feeling. I just had improvements in my workout, in my longevity. I had improvements in my brain. I felt like I could process a lot more, a lot faster. But that's the only thing that I've ever felt. Remember, for me, I said this was about longevity, vitality, and prevention. And so I don't feel anything other than I just feel good, which I've always felt good, but I just feel good. And I want to continue to feel good. I'll be 50, not too long from now. And I want to stay 25 forever. And so that's my main focus, is prevention and being able to, have that long, healthy, vital life. What patches do you recommend for painful blood clots on your legs? Okay, so we need to go to the doctor to see why we have painful blood clots. That is not a good thing to have blood clots in it's one thing to have varicose veins or spider veins, but to have blood clots, I would absolutely get to your doctor. If you've done that, then, consult with them, see what they recommend, what you should do for sure. When we look at pain, we would use our pain protocol, which is, of course, X39. We would use Eon. Eon reduces inflammation. Inflammation causes pain in the body. It's also the root cause of disease in the body. And then we would also use ice waves specifically on those spots where there are pain. But I would consult with a physician first why there are clots. There should not be clots in your legs at all. One of the inflammatory markers in EON that it helps reduce is fibrinogen. Fibrinogen is a blood clotting factor. Platelets and fibrinogen come together to clot your blood. So when you have an accident, a cut, or when you bump your leg and you're going to get bruise forming, it's the fibrinogen and platelets that come together. Most people have high fibrinogen. And so if you you can do your research, look at coronary artery disease, right? Heart disease. We see that number one indicator is high fibrinogen. It's not your cholesterol. It's just the thing they can market to you to give you a drug, Lipitor, for the rest of your life. Fantastic. Is that actually repairing your heart? No. You stop the Lipitor and your cholesterol is right there where it always was. It just makes the number look pretty. So we want to look at what's going on in the blood, what's going on in the body, what are those processes, but we want to make sure we're looking at our fibrinogen level. So ask your doctor. They can pull simple blood work, do a CBC, and add fibrinogen to it. We did that to my daughter when she was 3 and 4 years old to figure out why she was bruising so bad. She had low fibrinogen level, which is not common for people. It's very common that people have high fibrinogen, which is why they have thick, sticky blood that clots and clumps together. And there's where you have your heart disease and your heart attacks. So I would definitely do these for sure. And no, definitely no conflicts with medications, but of course, check with your physician. But we're not putting anything into the body with this patch. So there's no chemical, no substance, no nutrient, no vitamin, no mineral. This is a biophotonic exchange of information. Our body's light communicating with that lattice structure that's embedded in the patch, reflecting back a specific wavelength of light into the body. So there's no, it doesn't even work the way a medication does, right? A medication, a supplement, an herb, you have to swallow them or drink them. Your body has to assimilate it, it has to digest it, process it, things like that. This doesn't work that way. This literally works by pathways, signaling peptides, which are chains of proteins in your body. So totally different. Are people getting improvements with varicose veins and patching? Yeah, absolutely. Yeah, definitely. Again, using the X39 and EON for sure. Absolutely. Can you wear the X39 and the EON the day during I have breast biopsy done this Friday? There's no reason why you can't. I'm guessing it's just a simple, quick little outpatient thing. I had somebody ask me not too long ago when they were going to go get a CT scan and an MRI. And I'm like, I wouldn't wear it on that day. You're going to be in a tube. They don't need any extra things on their imaging, blocking anything potentially, or anything like that. So no, don't wear it. But if you're doing a biopsy, there's no reason why you would not need to. I know, like, for example, when Laura had her hip replacement last year, when we first found out about this, she didn't wear the patches during surgery. I mean, we're talking full-blown hip replacement. The second she got out of operating room into recovery, her husband slapped those patches right on her, right next to her incision, right next to the bandage and everything else. So you should be good. It's personal choice. I'll just say that. Is it okay to use EON if you're on a blood thinner? Yeah. So here's the thing. When I first got involved in this last year, I was watching every video I could from David, every single thing. And there were a couple of videos where he was specifically talking about the EON reducing inflammation. And one of those inflammatory markers was fibrinogen. And as I had mentioned, my daughters always had low fibrinogen levels when she was little, which caused all of her issues. And then, of course, again, when she hit puberty, her fibrinogen level was low again. And so when I asked him, I said, my concern is she has low fibrinogen. If I put this on her, she's going to bleed out. Like, if this lowers her fibrinogen level. And he said, no. Every single patch that we have is made to bring the body into balance. It will never make an excess or a limited amount of something. It is always going to bring into balance. So you can rest assured that it's not going to lower her fibrinogen. It will bring her fibrinogen into balance. So same thing if you're on blood thinners, bringing the body into balance. Of course, again, please check with your doctor if you have questions, but the EON is designed to bring the body into balance when it comes to those inflammatory markers. And with her, I'm happy to say that 30 days into using X39 and EON, her bruising stopped and her hormones completely balanced out. She had not had a period in 3 years. And the last ones that she had were so bad that we almost had to put her in the hospital with a blood transfusion. And literally the first 30 days, she started having normal periods, and she did every single month. And they were normal, like start and stop, which was absolutely a godsend, a blessing, right? So much changed for her that first year. So, but I would always check with your doctor if you have questions, okay? So these are wonderful questions. What other questions do you guys have? You can either unmute yourself if you want to, raise your hand, or pop them in the chat. Blood clots, carnosine and ice wave or Nirvana system for pain is my new favorite. Oh, well, that's great to hear. Thank you, Lori, for sharing that. That's wonderful. A friend just got diagnosed with Parkinson's. Okay, so again, we can't talk about a specific disease, but when we talk about the brain, we want to look at how to help the brain to function better, because we know that a lot of these things are neurological, right? So we always start with X39 and Eon. This is always our starting point. We always want to reduce inflammation in the body at the same time that we are increasing the body's own stem cell production. And the reason why is a great explanation that David gave in one of those first videos. And he said, if I'm going to go in and do a stem cell injection, say, for example, into my shoulder, I have lack of mobility, range of motion, I have pain, maybe I have a torn rotator cuff, something like that. So I'm going to do a stem cell injection. I'm going to inject 2 million stem cells into my body. This area is full of inflammation, right? That's where the pain and all the problems coming from. It's full of inflammation. So I inject these stem cells, the stem cells go in, the inflammation consumes the majority of those stem cells. So if I inject 2 million into my shoulder, I'm probably going to be left with 200,000. Would you like 200,000 or would you like 2 million? So we're going to address the issue with inflammation at the same time we are increasing and elevating our body's own stem cell production. That is vitally important if you want to get more rapid repair and regeneration happening inside of your body, and you want all of your stem cells to go to work doing what they need to do and not having to fight with the inflammation that's in your body, okay? And so we always want to start here. Then we look at the brain. When I look at the brain, I of course look at carnosine. Carnosine is a massive antioxidant. Your body produces it. This helps your body produce it correctly. And the carnosine goes to work to balance the brain, left brain hemisphere, improve cognition, communication, things like that. So I always like these 3 patches when I look at the brain. And the other patch that I like to use is also X49. X49 is fantastic for the brain as well too with that. But the other thing you might want to look at is glutathione because of the detox. There's probably toxins in the brain. We know that carnosine will pull out heavy metals, specifically aluminum, from the brain. We know that glutathione is going to neutralize those toxins in your body and eliminate those. And so, making sure that you don't have toxins, which we all have toxins from our food, our water, and our environment. I mean, heavy metals are crazy, and it's insane what they do to your brain. So you want to make sure that you're doing something to help the body to detox. Remember when you have a car and remember when that check oil light button comes on and you go to the dealership or you go to the whatever Jiffy Lube and you change your oil, right? Every 3,000 or depending on the age of your car, maybe 10,000 miles. Or when the light comes on, you're changing the oil, because if you don't change the oil, the car's not going to function correctly. Well, our bodies are the same way. The problem is people don't want to detox because they don't want to sacrifice their food, or they think they're going to be on the toilet, or they can't go to work, or they're going to be in pain, they're going to feel miserable. And so people don't get rid of the old yucky oil in their body. And so they're not doing those quarterly detoxes. And you really should be detoxing every quarter. Something, right? Some type of detox, whether it's a heavy metal detox or a parasite detox. Think about pets. How you take your dogs and cats to the vet to be dewormed, right? Why are we not being dewormed? Why are we not doing that ourselves? We're doing that for our pets. It's really important that you get rid of those things in your body that wreak havoc in your body. And so sometimes when we see these different types of autoimmune and different types of neurological disorders and things, it's a buildup of toxicity and a lot of toxicity. And so we want to make sure we're addressing that. And carnosine, of course, does, because carnosine is a big antioxidant that helps to detox the body, but not in the same way that glutathione does. And I'm not saying you need to use all these patches at one time. You could definitely start with X39 Eon, give it a couple weeks, knowing that I'm getting my body back in balance, I'm helping reduce inflammation, add in, glutathione one day, carnosine the next, rotate those every other day, glutathione, carnosine, do that for a couple of weeks until you get to the point where you're using all 4 of them every single day. And then maybe you want to, add in X49 down the road. It's a personal choice what you want to do. You don't have to use all of the patches. And here's the thing I want you to understand. You can use all the patches. You can absolutely use every single patch you want every single day. They all work individually and they all work synergistically. You're not going to over patch yourself. But I want you to know you can just use X39. Okay. You can just use this patch right here. I don't know what it's going to go to work on first in your body. I don't know what order it's going to go to work on anything in your body. So if you're telling me I have neurological issues, I have complications right now from something that's going on in my brain, I don't know that this is going to go to your brain right now. I don't, which is why I always recommend using supportive patches, because they are very specifically created to target specific organs and systems in your body. And so if you tell me my brain is having some issues, I'm going to say, well, we're always going to start here, no matter what, in my book, but let's do something to support that brain. This was a huge, huge thing for my daughter with communication. We started with these 2 the first couple weeks, and then we added in carnosine. Made a massive difference. She wasn't able to communicate with us verbally, and she was able to after using these patches, and on a very consistent basis, not only with us, but with family and friends. Made a huge difference to everybody that was in her life because she was able to communicate with them. And it made a huge difference to her because she was able to communicate with them. It brought her so much joy. And so when I look at the brain, I want to look at carnosine, and I also want to look at glutathione to help the body to detox and to boost that immune system. So keeping all of that in mind, you can definitely do whatever works best for you. But that's why I recommend supportive patches, because of the fact that I can target specific areas immediately. And those stem cells, your stem cells are going to work. They're going to do whatever they want. If you just use this patch, maybe it'll get to your brain and do the things you want in your brain in, maybe a month or 2 or 3, maybe a year or 2 or 3. I do not know. I can never predict that, and neither could you, because you can't predict what your body needs first. It's like when you cut your finger or you break your bone, it's not the Band-Aid or the cast that goes to work to repair the body, it's the body. And so your body says, oh, there's an injury. Okay, let me go to work and fix that. That's the body doing it. And so when you increase your own stem cell production, the body's going to decide what needs fixed first. You don't get to decide that. Okay. It's not like a stem cell injection where you're like, my knee's killing me, put the stem cells in my knee. You can't direct it, but I can tell you what, we can put the Eon and the Ice Wave on that knee and get rid of the pain. We can help you with the arthritis with the glutathione with that pain. So we know we can use these patches because we've just seen it in studies and we've seen it with people, right? As far as children, we have no clinical studies with children for obvious reasons. And so we can't recommend that you do use this with children. Have we used this with children? Those were the first 2 people I patched, were my son and my daughter, but that's a personal choice. I'll just say that. Supporting kidneys. So when we look at the organs, a lot of the patches support kidneys. So you obviously always, again, want to use X39, but I will tell you what patches and based on the clinical studies do support kidneys. And you're kind of be like, oh my God, I can use all of those. So Eon does, glutathione does, carnosine does, Alavita does, and SB6 does. All of these patches support the organs, all of them. They all support the organs in different ways because they're targeting different peptides, but they all will support the kidneys, and they'll support all your organs in your body, your liver, your intestines, your pancreas. They all support them, but they do that in different ways because they're targeting different peptides, different pathways, but they all do. What do you recommend for kidney function? Well, so X39 Eon. From there, if I had to pick a patch, oh man, that's hard. I would want to muscle test the person myself personally, because I would want to know, like, I would want to feel what's going on with them intuitively and kind of see which one would be best for them. But let's just say the person you're referring to, Julie, if I would say it would definitely benefit them to use Alavita for their kidneys. Absolutely. For the person that, Julie, you're specifically referring to, obviously the Eon, of course. Glutathione would definitely benefit them as well too. So definitely Alavita, glutathione, X39, and Eon for the person, Julie, that you're referring to with kidney function. So there you go. I don't even need to talk to him. I just told you by proxy. Okay. Are the patches safe to use on pets like cats and dogs? Heck yes. Oh my God, yes. So the horse patch. Let me talk to you about the horse patch. AccuLife. AccuLife is a pain patch. It is identical to IceWave. If you were ever out of IceWave, just use AccuLife. I use AccuLife on Brent all the time. We don't have horses. We don't have pets that are in pain. He has, when he goes golfing, his ankle hurts. I put the AccuLife on him because I know my dog's like, what? Or maybe she's snoring. But yeah, the AccuLife and the IceWave are identical, but they're just for pain. Okay. You can use the X39 on your dogs and your cats and your horses and your chickens and your cows and your ducks, all the above. You can also use Eon on them. And we do have people that actually use glutathione on their pets as well too, especially horses, because of the different things that they're exposed to, different types of toxins they're exposed to. So if you're on dialysis, you're going to check with your physician, of course. We do have people that have been on dialysis and have patched. I'll never forget, what was his name? Shoot, I can see him. I can't think of his name right now. But anyways, I interviewed him earlier this year, and he had been on dialysis for 41 years. Since he was 16 years old, he had been on dialysis, 6 weeks using this patch, and he was urinating on his own. And he had not urinated on his own in 41 years. That was impressive. So ask the person that invited you. They can go to our Telegram channel, or Karen, maybe you're in it, and you can type in dialysis, and you'll see all kinds of recorded testimonials from people. What patch would support a person who's recovering from a stroke? So we look at our brain protocol is X39 Eon, absolutely carnosine, and X49. Okay, so not that you have to use all of these up front. I would definitely use these two immediately and get on this one as soon as possible. And then again, X49. X49 and carnosine seem very similar. Building muscle mass, help with recovery, work to help tissue repair, work in the heart, work in the vascular system, work in the brain, but they work totally different. I've heard David say time and time again, if I'm looking at an issue in my body that I want to resolve, why would I not target it from different areas with different peptides, different things that are happening, processes inside of the body? And so absolutely 100%, this is what we've always used as our brain protocol. This patch came out last year, and David, from clinical studies that are still ongoing, is just blown away by what we can see. For example, cognitive decline, right? Think of your things that are associated with cognitive decline. He said we can basically eliminate cognitive decline in 30 days with these right here. Those are his words. I'm just saying his words. So I would use those. When we look at colitis, we look at the digestive system. So I would definitely use the X39 Eon and the SP6, definitely for digestion, as well as glutathione for sure. Glutathione every couple of days, maybe. Suggestions for lymphedema in the arm, not just pain, but for moving lymph. Yeah, energy enhancer. Heck yeah. X39 Eon. Energy enhancer. This is the patch that David invented 20 years ago when he was working for the Navy SEALs. And this is the patch that triggers beta oxidation, turns body fat into fuel. But another beautiful side effect, we have wonderful side effects with our patches, is that it turns over your lymphatic system. So when you're looking at edema of any type, we use the energy enhancer to move that lymph. You know that exercise turns over your lymphatic system. People that exercise weigh less typically, right? Because they're moving their lymphatic system. They're getting the toxins and the excess fat flushed out, right? And upon many other reasons as well too. But energy enhancer will help you with turning over that lymphatic system. You can use 2 sets of these if you want in that area to help move things through faster. Kendra, you have the book. There's definitely a protocol for edema in the book, so you can check that out with, I think it shows on the legs, but arms are same thing. Friend that was in a bad wreck with severe concussion about 4 weeks ago, lost his job insurance, wife found out a week before, colon cancer is returned, recommend patches. So for the concussion, again, the brain protocol would be fantastic. when you're looking at the colon, go to reverseagingwithghk.com. Dr. Lauren Picard speaks specifically on colon cancer and prostate. I know somebody mentioned prostate earlier, and breast cancer. He talks about those specifically in studies. Prostate is going to be your X39 and your Eon. We've seen huge things with that. And then when we look at colon, again, I can't talk about colon cancer, but I can talk to you about your digestive system, and that would be X39, Eon, SP6, definitely glutathione for sure. The master antioxidant, master detoxer. Does anyone get a little irritation from the patch, like a little red circle visible even after it's been off? So Taylor, she would come home, my daughter would come home from school every day, and I would take the patches off the back of her neck, right around dinner time, because she'd had them on 6 a.m. to 6 p.m. And every single day I put X39 Eon on the back of her neck, one on top of the other. We call them kissing them, not stacking on top, but one and then the other one below it. And every day she'd have 2 red rings, little circles, every single day. And they were always gone by the next morning when I got her up and put her patches back on, but they would be there the rest of the night until bedtime, always for 3 months. After 3 months, the red rings completely went away. The redness went away completely. I kept patching in the same area. I mean, she wasn't complaining about it, so I kept putting it in the same area, but you can change locations. You can put them below your belly button, or actually, if you're looking at like the X39 Eon, you can stick them anywhere you want. So you can move them around, but that's just, the skin is your largest organ, and it's how we detox. And if you're seeing irritations in the skin, that's why it's always beneficial to use the glutathione to help your body to eliminate some of those toxins like I was talking earlier. So you can add that in as well too, to help move some of that along a little bit faster. Hip pain, X39 Eon and Ice Wave. Absolutely. What's best for lactic acid buildup in the muscles? So when we look at muscle recovery, muscle repair, we look at carnosine and X49. Obviously, you're using X39 Eon, right? But we also look at those muscles, and that's X49. X49 helps with recovery, repair, building lean muscle mass, as well as carnosine. They just attack the body in different ways, right? So they target it in different ways. So that would be fantastic. Can you shower with them? Absolutely. They were created for the Navy SEALs. And then, like I said, we went on to the USA Olympic swim team, Stanford swim team. So, yep, you can shower, you can swim, you can sweat. Enlarged prostate, X39 Eon, when we look at the prostate for sure. And then somebody else said lactic acid again. Maybe that was the same person. Yeah. Okay. What did you say about the prostate, X39 Eon? Do any of these patches help to regenerate cartilage? So yeah, absolutely. So it was interesting. I was actually doing an event a couple months ago, and I was speaking to a man that owns a business here locally that focuses on different types of stem cell therapies, specifically for the older population to repair and regenerate the cartilage, because of them looking at knee replacements, hip replacements, and bone on bond. So we were having a great conversation, and I loved his explanation. So I was talking to him about X39. He does PRPs and things like that, $10,000 a pop. And so I was said, well, this is $3 a day. And he's like, this is fantastic. Signal your body to make its own stem cells. Absolutely. We talked about Eon. He's like, oh my God, yes, you've got to get rid of the inflammation. You've got to reduce the inflammation in the body. And then we were talking about glutathione. And I loved what he talked about, because he says doctors tell you can never regenerate your cartilage. That would put them out of business, of course, right? I remember 20 years ago when I got into this industry of holistic health. And I remember listening to Paul Zane Pilsner talking about him personally needing a knee replacement. And he started using chondroitin. What is it? Oh my God, I just lost it. Chondroitin. I just lost it. But anyway, I'm thinking, my mind is thinking glutathione, but he was started to use this, and within a total of a year, he went back to his doctor for a scan, and the doctor's like, okay, so you obviously do not need a knee replacement anymore. And I'm asking you to never share this with anybody, because if you do, then I'm going to be out of business, because you just literally repaired your entire knee and all your cartilage looks perfect. From what you were using. But basically the way the glutathione works, if you picture a sponge, like an old dish sponge, the square ones or rectangle ones, and they're sitting there on the sink. You remember that from your grandmother's house? And they're dried up and they're hard as a brick, right? You can hit them on the sink and they're hard as a brick. That is where your knee is when there's no cartilage in there, when everything is just bone on bone, painful. You're looking at a knee replacement, right? Well, when you put the sponge underwater, it's like woo, it goes up and everything is soft and smushy, and you can use that to clean. Oh God, clean your counters with that dirty old thing. But anyway, glutathione does that. It coats the joints. And so it goes in, you've reduced your inflammation, your stem cells are going to work to repair your body. It goes in to take that cartilage around there, that area around those joints, and puff them up again like a big full sponge, like a sponge full of water. So people do experience pain reduction, of course, and we do see that regeneration. And you can Google that, not Google, but you can search that in our Telegram channel as well too. People have shared tons of testimonials of no longer needing surgeries or replacements, carpal tunnel, things like that. Recommendation for chronic pain, 24/7, hardly walk. Diabetic, bad heart, hormone problems, Lyme disease, overweight, and can't exercise. Okay, Martha, girl. All right, so we've got a lot going on here. So we're definitely going to start with our X39 and we're Eon, right? This is where we're going to start. Ice Wave is what we use for pain on a specific area. So it's not going to eliminate full body pain. So we would have to look at where that pain is and what that looks like. But Ice Wave is what's going to get rid of the pain on the spot. It doesn't fix it. It's just going to give you immediate relief. Sometimes putting this on the bottom of the feet, that K1 acupuncture point, opens up the energy channels in the full body. Sometimes putting it on the low back, right around that sacrum area, really helps to eliminate the pain in the body as well too. We'll have to play around with that. So when you look at diabetic, blood sugar, obviously, heart, hormones, Lyme's, overweight, exercise. Okay, so let's look at a couple things, and this is not what we're going to start all of it at once, because you want to start slow. There's a lot going on with you. We would definitely use the carnosine to support your organs, specifically your pancreas, for your blood sugar. Obviously, this will help your heart as well too. We know that 100%. We also are going to look at using the X49 to support your heart as well too. We see from clinical studies that using just these two alone in 60 days reduces body fat by 11%. We know it builds lean muscle mass, and we know that it helps with bone density and stopping bone loss. So this is really important when you're looking at your weight and your lean muscle mass ratio to the fat ratio in the body. This is really important, okay? And then we would want to look at as well too for you the glutathione. Not initially, there's a lot going on with you, so we would look at adding this in slowly to help you maybe once or twice a week, to help you to detox some of this stuff out of your body, right? And then we can also, you'll start to, here's what will happen. Just with using these two alone, people are like, I actually feel like exercising. I actually feel like going to the gym now where I never did before. And so that's because of the peptides that are triggered in the body. Their body wants to build lean muscle mass. It wants to get rid of excess fat. And those two patches help you do that. Can you repeat the doctor and website for the colon cancer? Reverse aging with GHK.com. It's Dr. Lauren Picard. 50 years of research, clinical studies, everything under the sun, the benefits of GHK. Has nothing to do with this patch. Obviously, Dr. Picard did not invent this, David Schmidt did, but he was studying Dr. Picard's research for all these years and seeing the benefits of elevating your own GHK-Cu and what it does. So patients have pain at night in one place, pain during the day in another. Is it okay to use X39 during the day and another at night? No. So you only use one X39 a day. You use one and you use that during the day only. You don't use it at night. So use the Ice Wave for pain at night. Okay, put that on at night. X39 Eon during the day, Ice Wave at night. Headache for 14 years, day and night. Feels like his brain is in a vice and keeps getting tight. Okay, so that's a lot, obviously. Chiropractor, myofascial release, cranial sacral therapy, acupuncture, any of those body type works, treatments would be fantastic for him. I would also look at diet, obviously all of this, diet and lifestyle, right? But as far as pain, we can definitely look at X39 Eon Ice Wave. You may want to look at their Nirvana system. It takes about 1 to 2 weeks before that actually gets to that full amount to eliminate full body pain. But Julie, you might want to look at the Nirvana system, but I would recommend some type of body work, emotional work, clearing types of things as well too. Thank you, glucosamine chondroitin. That's why glucosamine chondroitin. That's why I'm like glutathione, glucose. I knew it was I couldn't get it out. Thank you, whoever you are. iPhone, yes, glucosamine chondroitin. Fantastic. Okay, where do you place the glutathione on the knee? Stick it anywhere. No, it works anywhere. It works anywhere. So we have a great little picture somebody shared. I think glutathione was on the right side of the knee and Eon was on the left side, the inside of the knee. I think that was the picture that we saw. I'd have to look back at my camera roll, but you can put it anywhere. It honestly is working anywhere. You do not have to stick the patch on that exact location on the body for it to impact that part of the body. It doesn't work that way. These patches work systemically, which means throughout the entire body, no matter what. If that were the case, then my stem cells would only be activated right here in this area. And that doesn't make sense from a biology standpoint or a chemical standpoint on what's going on inside of the body. So it works throughout the whole entire body. When I put this patch on, this patch is signaling a peptide in my liver. I can't stick this on my liver. My liver's in my body. It's signaling a peptide in my liver to activate and to increase its own glutathione level, your body's own glutathione level by 300 to 400%. Do the support patches have to be used daily, or can you use them twice a week or every other day? So that's a personal choice. I'll be honest with you. You can use the supportive patches every single day. And if you're looking at something like SP6, where you want to balance the endocrine system, or if you're looking at something, like say you're using carnosine for your heart or your brain, yeah, use it every single day if you've got an issue. Absolutely. If you're a healthy person, you don't have anything going on with you, yeah, then you can rotate glutathione one day, carnosine the next day, glutathione one, carnosine the next. That's fine. There's nothing wrong with that. Or if you're like me and you're a healthy person, you're like, I want all of it, and I just use them every single day. I just don't stop because I'm like, oh my God, you can't overdose yourself. It's your body's own body. It's not going to create an increase of glutathione or carnosine. So you can use them whatever you want. If you have something going on with you, then depending on the situation, like the lady I just said, you've got way too much going on. We're going to start slow and we'll weave in glutathione as we go because you've got a lot happening in your body. If you don't have a whole lot going on, glutathione may be one of the first patches you start with. X39 Eon glutathione, for your arthritis joints. Then you would use your glutathione, every other day. We know that it increases that glutathione level in your body by at least, 300, 400% and sustains it for a 24-hour period. Even if you take the patch off in 12 hours, which you're going to, it's still going to keep it elevated. That's the technology that we have with these patch to keep that glutathione level elevated for that 24-hour period. So that's a personal choice with what you want to do. So Linda, as far as countries, if we're open, so what you do is you go to lifewave.com, you click on the United States flag, and it'll drop down a box and show you all the countries we're open and you can search there. What are the benefits of the patch versus taking supplements? That's a great question. So supplements, I'm never going to say that you should, not take anything at all. I would never, ever say that. Supplements are, the difference is you have to ingest them. You have to swallow them, or maybe you even have to inject them, depending on what you're doing. But I'm going to say you're ingesting them, right? So let's say you're ingesting them, drinking them. Your body has to assimilate that. It has to digest that. It has to be able to process it in your body for it actually, it's going through your stomach. It's going through your intestines. If things are working correctly in your digestive system, fantastic. But if they're not, you may not be absorbing the nutrients that you're ingesting. And so that's where the kind of the, comes up with, what do I do? Like, I'm taking all of these pills. I've got my countertop lined up and I'm not seeing anything yet, or I'm not getting, or I've been doing this for years, but I still have these issues. Your body just may not be absorbing it. It may not be, working correctly. And so the way the patch works is not putting anything in your body. There is nothing to assimilate or digest as far as coming down through the, the digestive tract. This is working at the speed of light in your body. Like, you put the patch on, it instantly elevates GHK, instantly resets a third of your gene back to their young, youthful state, instantly starts your body in producing, activating, mobilizing its own stem cells, right? And so you don't have to do anything. You don't have to take anything. You just got to stick it on, take it off 12 hours later, stay super hydrated, right? But definitely know that there's no comparison because they don't work the same at all. But you can use your supplements while you're patching. You probably will find that you won't need as many supplements as you have in the past. So as far as a incisional hernia, I'm guessing that's one that's from maybe a surgery or something, since you're saying incisional, you could look at using the X39 and Eon to help reduce the inflammation in the area. Why is it not suggested to wear X39 at night? Because it gives you energy, mental clarity, mental focus, physical energy. It's a patch that's designed to be used during the day. And so you want to make sure you're using it during the day when your body's up and active and mobile and moving and doing things, and then take it off at night when you're resting and regenerating and repairing. That's the way David has created that patch. Use all the patches daily. I feel better than I have in decades. I love that. Absolutely, right? Just put them on, right? What am I going to do? I'm going to get younger and younger, and I'm going to feel more and more amazing. But I do want to share with you guys, this is really important that you understand, because, you know, I am not your doctor, and you may not be somebody else's doctor, right, or physician. And so we don't ever want to say, you know, these are the patches you have to use for XYZ disease. And I also want you to keep in mind that, you know, when people have a lot of things going on, it's always best to start slower and know this is my plan. My plan is I'm going to use the X39 and Eon, right? These are the two patches I'm going to start with no matter what. I'm going to address the root cause. I'm going to activate my own stem cell production, right? This was the #1 selling patch until David came out with this a few years ago, which obviously this is the #1 selling patch and this is #2. They work hand in hand and they work beautifully together to help you speed up your results. That's what you all want. You want it, and you want it now. I want my body fixed. 20 years of crap. I want it all fixed now. So this is going to kickstart you in that right direction. But if you say, I've got issues with blood sugar, let's throw this in. Let's use the carnosine too, so we can help you with that pancreas, right? Or you're like, oh my God, I'm dying in pain. Great, let's throw the ice wave in. That's perfectly fine. We can do this, right? But if you've got this really long list of issues, I may tell you, and you guys can always, you're connected to somebody in here that knows this, right? Your upline, somebody that you're working with, they know somebody that's been doing this for quite a while, right? And there are a lot of us in here that are holistic practitioners of one sort or another. And so you can say, you know what, here's the best protocol for you. We're going to use these patches, but we're going to use these for a couple weeks. And we're going to add this one in. We're going to add this one in. And we're going to make sure that we're, you know, you're feeling good enough. You feel amazing. You're like, I want them all, give them all to me. I'll take all of them. Or maybe you feel horrible and you're like, just give them all to me. I'll take them all. You can do that too. It's always your personal choice what you want to do. It's like if you go to the, you know, say you go to your, you know, nutritionist and they're like, these are the foods you're going to cut out. You can cut them all out slowly, or you can cut them all out one time, right? I remember when I learned about gluten, dairy, and sugar, and I'm like, okay, I'll do it. It's called Whole30. I'm like, 30 days, no gluten, no dairy, no sugar. I was like, oh my God, for 3 weeks, this was horrible. And then all of a sudden it was like, woo, I feel like I'm on top of the world. And it was just amazing, right? No gluten, no dairy, no sugar. Fix everything in your life. So you can do it all at once, or you can do it slowly, but we always like to, you know, when you have a whole lot going on, we really want to talk to you about, you know, adding things in a little bit at a time so you can see what you're feeling, what you're experiencing, what you notice. And again, that's why we're using our health tracker. So you can track initially, you know, a couple days out, week 1, week 2, week 3, what are the things you're experiencing? We want to make sure that we're having these conversations with you. This is not like sell you some products and go on your way. This is how can we really help you improve your quality of life? Really, really, we want to help you do that. And the people that you're connected with here in this team, that's our goal, is to make sure that you feel better and that you have the best quality of life possible. And we know that using these patches day after day, week after week, month after month, even year after year. You know, Bob Campbell, it took him 2 years before his skin cancer that he had for what, I don't know how many years, 20 years, I don't know, all over his body. He kept having to get it burned off every year. It took him 2 years before it just went away and never came back. So, I mean, I don't know, 2 years is going to pass no matter what. You're going to get younger, you're going to get older, you're going to get healthier, or you're going to get worse. So for me, I think it's definitely about that, being proactive and focusing on how can I help my body, and doing that in a way that I am supporting myself, and that I may not feel amazing every single day. I'm not going to lie to you, right? It's just like when you go and you have a bad meal, you're like, oh my God, that tore my stomach up. I'm never doing that again. And then you forget about it. And you're like, okay, I'll have that one more time. You're like, no, no, I won't do this again. So you may have days that you don't feel like super amazing, but that's why we drink our water, right? You want to stay hydrated. You're going to feel amazing as much as possible every single day by making sure you're drinking, at least half your body weight in ounces every single day. But as far as the cartilage protocol, and then we got to go X39E on glutathione, 100%. Double-blind study on patches for how long? Go to startx39now.com, startx39now.com. All of our clinical studies are there. Thank you, Laura. You can find all of them. You can look through all the studies and see which ones resonate with you. And of course, then definitely you can see all the patents there. Root canal, I would never have a root canal. Absolutely not. Go back to your dentist and tell them to take the tooth out immediately and put in a false tooth. Do not ever do a root canal. Do your research on that. You're going to cause every disease and cancer under the sun from root canal. So I would never, never, never do that. You're going to be stuck with infection in there forever. And it's going to lead to every tooth is connected to every single organ in your body. So every section of your body is connected to your teeth. So don't do that. Go get it fixed for sure. And as far as patches in the meantime, you can support that with X39 Eon and glutathione, carnosine, but yeah, go get that pulled out. So thank you guys for being here tonight. I hope you got value from this. I hope you learned something, and I hope you definitely, feel like you can contact the person that invited you. That's what we want you to do. Get your questions answered. Again, they're connected to somebody else. If they don't know the answer, somebody in your upline does. We're here to help you and support you and guide you in your journey to wellness. So thank you all. Have a fantastic rest of your week. Have a Merry Christmas this weekend. Happy holidays, happy Hanukkah, Kwanzaa, whatever, all of the above, all the love. And we will see you back here next Tuesday. Thank you, guys.